Yo, 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 yo. Happy Sunday to you and welcome to the show. It's me, Lady Wu, and you are listening to the Abby Award winning Vital Show right here on B94.9 WATV. Got my crewmates in the building. Guys, introduce yourselves, please.
It's your boy Ready Eddie.
What up, this Jermaine.
Jermaine, welcome. Ready, Eddie, welcome. And we also have guests in the virtual studio, but we are going to go ahead and get started. Um, I want to invite everybody that is watching online to continue watching. I know that you're like, what? We hear you, but we don't see you. Woo. I'm here, but I'm trying to figure my side out. So in the meantime, just keep watching and keep sharing. Thank you guys for coming on in the studio. Stay here, share the video. Sharing is caring. So tonight we have a big show in order for you or in store for you, in store for you. It's educational. So the first part of the show will be educational with a team from UAB. And then the second part of the show, we are going to be talking to you and sharing in conversation about the holidays, about the big fight last night. Did y'all see the fight? Or was it a big fight? Or was like, what was it? We'll be talking about the Iron Bowl. We'll be talking about a lot of things in the second half. So, first half of the show, I'm going to go ahead and add our guests to the virtual stream and welcome them. We have Dr. Olivia J. Clay, and I see Jasmine. Hey, Jasmine. How are you all?
Good evening.
I'm
Good evening.
good, good. How are y'all doing this evening? Yes,
We
evening.
are we are great. Yes, it is evening. We are great. So welcome, welcome, welcome to Vital. I want to get straight in with you guys. I know that a lot of people are still celebrating the holidays. You may have to return to work tomorrow, so I don't want to cut into that. I want you to get all of that time that you deserve. But you all are here to talk about something that does not get a lot of conversation, and it affects a lot of people, but we don't talk about it. We don't even know how to talk about Alzheimer's, not old timers, Alzheimer's. So tell us a little bit about who you are and what you do, what your relationship is to Alzheimer's.
All right, I'll start. Olivia Clay here. I serve as the director of the Community Outreach, Diversity, and Inclusion Core of the UAB Alzheimer's Disease Research Center. And basically, we are a center, we're a network of centers throughout the United States, and we serve as one location where we
Mhm.
all collect the same data from not just individuals with Alzheimer's disease, but all adults in our center age 55 and older, and we just study brain health, and we
Okay.
combine that data with other centers throughout the country in order to study brain aging, Alzheimer's disease, etc. On a nationwide level.
Awesome. Okay.
My name is Jasmine Dunning. I am one of the clinical research coordinators for the Alzheimer's Disease Research Center at UAB. So one of my roles is I'm the one that kind of makes point of contact. So if anybody that calls the center that wants information, I'm the one that they would speak with. I would give them information about the study, and then I would also be the one that would do all the memory testing with them. So I'm the one that is doing the memory testing, that is coordinating the visits, and that's pretty much like their face-to-face contact with the center.
Oh, awesome. So a team effort to get people in for Alzheimer's research. So why is this research important? Like what brought about the need to research Alzheimer's
Sure.
or brain activity?
I'll speak on that a little bit. So research is part of our activities at the center. So again, we also try to get information about Alzheimer's, tell individuals what they can do to reduce their risk. Because when it comes to Alzheimer's, really prevention is the best thing that you can do. We know people with Alzheimer's get progressively worse over time. There are different strides that are being made to slow the progression of the disease, but it is one that gets progressively worse. And
Mhm.
as African Americans, we're twice as likely to develop Alzheimer's disease, specifically later in life. So
Mhm.
that's one of the reasons, with us being here in Birmingham and the increased risk in African Americans, and pretty much everyone knows someone that either has Alzheimer's disease or that has not got a diagnosis, and we're pretty sure that's what it is. So
Yeah.
really, just based upon where we are here in the Deep South, that's one of the main reasons why it's important for us at the UAB Center to study Alzheimer's disease.
Gotcha. Um,
What is
that
Alzheimer's?
that was my
Okay.
question. Thank you, Jermaine.
Yeah. So the way I like to describe Alzheimer's disease is basically you having nerve damage going to your brain, and so your brain is not functioning properly. I kind of one way I like to try to explain it, that people are more familiar with is so for instance, think about someone with diabetes. We know older adults with diabetes that have problems with feeling like in their extremities if they have neuropathy or if their nerves are dying going to their hands and feet. So we know a lot of people with Alzheimer's disease that have problems with feelings. If they have some type of damage to their fingers or their toes, they're really hard to heal. We know older adults that have amputations and things like that because of the nerves dying going to their hands and feet. And so we kind of think about the same thing with Alzheimer's, with the nerves going to your brain. If those nerves are damaged or basically dying, then your brain is not going to function properly either. So I try to compare a person with diabetes having neuropathy and the nerves dying in their extremities, similar to what's going on with Alzheimer's disease and the nerves dying going to your brain.
Wow. So not that something has to happen to the nerves. Is it with time or what? Is that what you were
There are a lot of different causes. It could be age. It could be the person had some type of stroke. It could be things such as diabetes. Again, if you're having that death going on with your extremities, your hands and feet, then the nerves going to your brain are the same thing. It could be with some type of traumatic brain injury, etc. So multiple causes of why a person could develop Alzheimer's disease or some type of dementia.
So is dementia a code name for Alzheimer's? I know a lot of people get it confused. I
Yeah,
know.
so let's talk about that. So there are different types of dementias where we really associate dementia with memory loss. So people can have memory loss for a lot of different reasons, and so it doesn't specifically have to be Alzheimer's disease if a person has memory loss. But if a person has Alzheimer's disease, then memory loss is just one of the symptoms of Alzheimer's disease. So you can kind of think of it as two separate things. Dementia is the memory loss. Alzheimer's is the memory loss plus additional things, and you get progressively worse physically with the Alzheimer's disease, where you might not with some other type of dementia.
My
Wow.
grandfather actually died last week
Wow.
of dementia, rather.
Oh, sorry for your loss. Sorry for your loss.
Yeah, definitely. And I guess it's one of the things that we don't really understand as far as like what happens with the body. We
Gotcha,
see the
gotcha. That's a
progression
great
of
question.
what's going on with him.
Yeah.
That's a
My
great
my
question.
my great grandfather had Alzheimer's. And, like in our communities, it's one of those things where it's sad to see your loved one going through
Mhm.
those stages of losing themselves,
Hmm.
and basically losing themselves, not knowing who the relatives are,
Hmm.
and a lot of times you hear about them walking off or
Hmm.
just you hear about all of these different things and we don't know sometimes you'll laugh to keep from crying, sometimes you'll laugh because it really is like, wow, really.
Hmm.
But it's so heartbreaking because until now, this show right here, we aren't having these conversations. We
Right.
don't understand what happens to them. We don't know what it is. We don't know what happens.
And
Right.
and the thing is that when you mention that, I hear a lot of time that the caregivers, when their loved one is going through Alzheimer's or dementia, sometimes the caregiver could be in a little bit of a little bit in
Yes.
denial about
Hmm.
it, just because they're like, oh, they're just getting a little older, or they might say, oh, that's just how grandma talks. Sometimes she might forget that she's in 2020, and she'll start reverting back to stories in the 1950s or 60s, things from her childhood.
Yeah.
And a lot of the time they're thinking, oh, she just telling the story. No, her mind really thinks she's in the 1960s or 70s.
Hmm.
And a
So
lot
so
of
with
time we're having to counsel the caregiver about it.
Yeah.
so
Go ahead,
a
Jermaine.
question like so with that like how do they die? Like what creates them to
Yeah. So let's get to that. So let's talk about the physical changes. So we really see the physical changes in the later stages of the disease. So think about when your brain is working properly. You do things. It seems like almost automatically. So if you need to go to the restroom, you don't really put a lot of thought into going to the restroom. Your brain just pretty much automatically does it for you when you get that urge. But if your brain is not working properly, then you can't, do things like go to the restroom or, raise your arm when you need to, or remember to eat or swallow, or, eat, even your legs to walk, don't really function as they should. Your breathing, because your brain controls all of that, breathing,
Everything.
swallowing,
Yeah.
all of that. Yeah. And so that's what we see in the later stages. It's almost like, since your body doesn't have the proper function from your brain, it basically shuts down.
Mm.
So one thing that was going on in my family is that the people that are around my grandma often are seeing her forget things, and she's
Hmm.
79, and they like she got dementia, and I'm like, well, how can we tell the difference between when an older person is starting to just forget things naturally as their
Right,
brain,
right.
declines versus, it needing to be looked into that it may be.
Exactly.
Very important. Yeah, that's a good question too. So, if an older person forgets where the keys are, that doesn't mean they have dementia or
Right.
Alzheimer's.
I forget
We
where the
forget
keys
that
are.
too, right? So you have to think about more changes that are a little more pronounced. So, like, if they go to the mall and can't remember how to get home, and they have to call you to come and get them, or if they keep forgetting who people are that they see on a regular basis.
Mm.
So things that are a little more, if a person repeats themselves, if they tell you the same story a couple of times, then that might just be regular aging. But if you see more of that, more of these things, if you see, changes in behavior, changes in their attitude, if they get easily upset a lot of the times, it might just be because they're not remembering things. And so they're really getting frustrated. So really just more changes in who that person is. If they don't do things that they used to enjoy anymore, more of those types of changes are really what you really need to look for.
Gotcha.
The education piece of this is so important because in order for people to care anything about research, the conversation prior to why I need to come and be a part of the research is important.
Exactly. Exactly.
So, we got a lot of comments coming in. And I think so. The one that Demetrius Crum just put, I'm going to go to that in a minute. But precursors or some determining factors that may speak to the idea that this person or this disorder may turn,
Mhm.
they may be a proponent for Alzheimer's. What are some of those things?
Right, right. So one thing that we try to say is, what's good for your heart is good for your brain. So,
Hmm.
if you have, things like diabetes, if you have high blood pressure, those are risk factors. As you age, of course, age is a risk factor. Genetics, your family history, a lot of different things like that. Being obese. So a lot of your main physical problems, other comorbid conditions, as they call them, or medical other health conditions, are risk factors for having later developing dementia or Alzheimer's disease.
So with Alzheimer's, is it because of we as Black people we have those other ailments, or is dementia or Alzheimer's a one thing that
That puts us at greater risk. Yeah, you can kind of think of it like COVID.
Mm.
It's something that, if you have those other conditions, you are at greater risk.
so is that one of the reasons that Black people deal with it more, or is it just naturally we deal with it
Or,
more?
or do we deal with it more?
Yeah, true, true, true.
Yeah, we are more likely to develop Alzheimer's. Now, when you talk about early stages, because some people might develop it as early as like 40, sometimes late 30s. So you don't
Wow.
really see those differences in early onset dementia or Alzheimer's disease. But the kind of 65 and older, within that age group, we definitely see, we're really at like twice the risk when compared to whites of
So with
having
40 year
Alzheimer's.
olds, like how
That's
do,
the part I want to
yeah,
know.
like how do we know that we might be dealing with dementia at this age? Like,
Yeah,
Right now.
yeah. I mean, like I say, you'll see the changes, or your family members will definitely see the changes. That's why with our research studies, we don't just take people that have memory problems. We want to study, aging in general. So we look for 55 and older. You don't have to have memory problems. You don't have to have any type of dementia. You don't have to have Alzheimer's disease, because we want to be able to compare, people who are aging normally to people
Right.
who have these issues, or help kind of identify some additional risk factors in addition to what we know already.
So Jasmine, we're not going to keep you just sitting there. We're going to talk to
Yeah,
you,
yeah.
but this is
I was want Dr. Clay answer all the questions. I was like,
No,
he's
no, we're getting up to the research. So we're
we're
doing
going to
the
build to that
background, and when
part.
we get to the study, I'll kick
Yes.
back and let Jasmine handle it.
Exactly. But this medical part is so important because, you mentioned even looking at the ages, most people think that, okay, this is old people. This starts when you're already older. So for you to
Right,
say late 30s, 40s, all us looking like, sir, what are you saying?
right,
First of all, what you talking about? But then
right.
the
see,
other part of that, you're a physical doctor, right, Dr. Clay?
No, no, no. I'm a psychologist.
Psychologist.
I'm a
Okay, so that's
developmental
but
psychologist. But the UAB Alzheimer's Disease Center Research Center is within the School of Medicine at UAB.
okay, and that's why I asked. So where I'm headed with this, with my next set of questions, is from a mental health perspective.
Hmm.
Um, when you think about, you spoke about comorbid conditions that are physical conditions, which is why I asked you that question about what type of doctor you were. But
Hmm.
when I think about certain disorders, ADD, ADHD, maybe mm, maybe that one in particular, like brain functioning and brain design.
Hmm.
With do you think, do you have an opinion on that, or has any research already been done on that brain?
Yeah, yeah. Not as much.
can
That,
I want to chime in on that just because
sure.
Come on, Jazz.
what we've seen sometimes with the neurologists, they'll be able to decipher whether or not is this memory loss or does this person have adult attention deficit disorder.
Yeah.
Mhm.
And we have seen it within some of we have seen that in some cases where the physician's like, oh, this person has attention deficit disorder, because it's a lot that goes into it versus just memory. Like, so
Yeah.
when it comes to
Health
the
issues
memory
out here.
testing, it's a lot that goes into it, especially because we do a lot of memory testing. And so from the memory testing, that person, we can tell if they are either paying us attention or if they really just don't get it. And there have been cases where I've tested somebody where they've done great on certain parts of the memory test, but because we're testing you for about an hour to hour and a half, that person might just lose interest and just get distracted.
Mhm.
Okay,
So
so that's why I'm
we've seen
asking
that.
all those questions, because
Mhm.
that sounds like what I would be doing in an assessment for Alzheimer's. Like, what? First of all, what am I doing here? But I would, like, I asked the question from two point, from two ways. Like, I'm a mental health professional and I'm somebody who lives with ADHD, so I want to know: do I need to eat more blueberries because I don't like them? But if I do, or do I need to take some? Like, let's have that conversation.
Mhm.
So I'm asking from a real place. Eddie, what you got?
Yeah, 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 yeah. And kind of like Jasmine was saying, it's very important, to determine, is this dementia or Alzheimer's disease, or is this something else like, ADD or ADHD that's causing them not to do as well on the test? Is
Yeah.
it that they just had a stroke and they can recover from the stroke? Are they still taking some medication that their doctor thought that they were supposed to, had told them to stop taking when they gave them an additional prescription? Because a lot of people are over medicated sometimes, and of course,
Mm.
medications have side effects. So sometimes people have side effects of taking different medications that don't mix, that might affect their memory and their functioning as well. So very important to determine, is there some underlying cause of this memory loss that can be fixed, or is it temporary compared to if it's something that's going to be around long term? But I know you went into diet. Again, diet is very important. We know diet, if we change our diet, it can reduce our risk of a lot of different physical conditioning. So to go back to diabetes, a lot of people think once you develop diabetes, that's just something that you're going to have over time. Where at least half of the people with type 2 diabetes, now not type 1, but type 2 diabetes, at least
Right.
half of the people with type 2 diabetes can get rid of it with a change in their diet and exercise. So changing
I'm
your
saying some
diet,
great.
exercising more, can decrease your risk of developing dementia or Alzheimer's disease. Again, it's not, it's like anything, it's not guaranteed, but it
Mhm.
will reduce your risk.
I'm seeing some great comments over here to the side. Shouts out to Demetrius Crum. Where they at though? Shouts out to you and these awesome statements that you're making, and personal, like sharing personal stories. That is what makes
Definitely.
what I'm saying? That's what makes these moments mean more. So like Alzheimer's research, when you all reached out, like absolutely, because we need to have
Mhm.
the conversation. He's mentioning some things about illegal drug use and how
Mhm.
that impacts the brain and things like that. But
Right.
in studio is another mental health professional who I know is about to come with something prolific. What you got, Eddie?
I when I work with kids, I play this game called the Ungame, and it's not
Mhm.
really a game. It's just a bunch of personal questions. But
We're
Okay.
gonna
when
call it a
you when
game
you
today.
play it with when you play the game with kids, they get into it and they answer personal questions
Right.
that they
They
wouldn't
do.
otherwise.
Yeah.
They
And
do.
a question always came up that said, "What is the worst thing that can happen to one of your loved ones?" And the kids always say that a loved one can die.
Hmm.
But when I explored that question, for me, it was dementia,
Okay.
Alzheimer's. It was
Mm.
like because my mama been preparing my whole life for her to die and go to heaven. So that ain't
Mhm.
even from my
Right.
perspective. That's
Like I'm okay with that part.
that's
Right.
fine. But I
Right.
and I don't know if it's selfish or not. But the idea that I don't want to be forgotten
Mm.
is like it bothers me. Like the
Mm-hmm.
concept of it bothers me. So I empathize heavily with people when I meet them that are dealing with family members that have Alzheimer's.
Yeah, that's deep. Like you, so
It
that
is.
part, and that was another question that I saw over to the side, and then we're gonna, Jermaine. I think you were you kind of like, but
Yeah, I got a question.
okay, so I'm gonna get that one, and then we're gonna take a break and come back. But the thing that I wanted to mention, I just forgot. Yeah. So yeah, with that being said, what a great show to forget in the moment.
It's contagious. We say memory loss is very very contagious, especially where we work. It is very contagious.
Yes, 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 yes. Like I really forgot. I'm not doing this for rating. Jermaine, go ahead.
So my question was kind of like what we hear where they say that people with Alzheimer's they go back to their childhood. So are
Hmm.
they going back to their childhood, or are they naturally dead? Are
That's
they
it.
like a spirit?
Yeah.
And
Yeah.
like next level thinking, like people say, and I had a conversation like this on Facebook. I was saying like, do people revert back to their childhood because they're getting ready to start life over again, or just
Mm.
naturally it's just something that goes with time?
Gotcha.
Before you
Gotcha.
all
Oh,
answer, let me add because that made
but
me think of where I was going. I was gonna say like the time and place that they go back to. Like, have you all studied? Has that come up yet, or are we trying to get to that by getting people in the study? Like, how did I decide to go back to a time when I
right.
was 6? What was going on at that time?
Right. Yeah, I think part of that has to do with the nature of the memory loss, like, what goes first. And then, it seems like in a lot of people, the short term memory goes first, and those longer
Mhm.
term memories, last longer. Places that they were, where they were happy, places where they were longer. So if they lived at a certain address longer, they might go back there. Again, it seems like the short term memory loss goes first, and
Mm.
kind of with the nerves going to the brain dying again. That's why they kind of you see the reverting back to not being able to take care of themselves. Having to wear things like the pins and things like that. So you kind of see that reversion as well as far as not being able to take care of themselves physically. So I think it's a combination of the two: the order in which the memories are lost, and then the loss in function because of the brain not properly functioning.
And
So
that's
so
true.
it's
Whenever
same
I've
child.
tested patients, they told me stuff about they told me about their previous employment for the past 20 years. Oh, I worked here for 20 years. I was this, I did that. But if I ask them, oh, well, your loved one told me that y'all went somewhere last week to celebrate a birthday, they're going to be like, oh, I don't remember. Or they're going to be like, I just don't know. But they can tell what they did 10 years ago about their job, about their wedding, about their child's birth, all those kind of things.
Let's take a quick break. So to me, that says a lot about being mindful, embracing each moment as you have it. Because if right now we're making long term memories, I want
Right.
to be able to hold on to those. So we're
Mhm.
gonna pay some bills while we make memories, and we'll be right back in just a few with the UAB Alzheimer's Research Study and the Abbey Award winning Vital Show. Be back in just a few. All right, everybody. So for those of you who are watching online, we are going to read some of the comments in the quick break. And yeah, y'all have at it. Who wants to read the comments? Rain or Eddie?
I read some comments. I don't think I'm getting all the comments.
You
I,
don't see them?
I can't even see the comments.
Yeah,
Oh, really? Oh, okay,
I
sorry.
don't know which page we're supposed to be on. 94 or yo.
These I don't know where these comments are coming from.
Yeah, the
So
person you were naming ain't where I'm looking.
what you see?
She on
What y'all
Facebook,
see?
huh?
I'm on Woo. I see Misty sent something and Kathy, but you named the person.
Oh,
I ain't on their stream.
well, yeah, you can share. You can read what your people said. I
Oh,
need to.
oh, yeah, that's who you're
You see
saying.
that?
He's on the stream yard link. Yeah,
So maybe like through the show or something. I mean,
yeah.
somewhere.
On this side,
Oh, that's it, right?
Philip McGee said he's cared for two aunties who had it. It can be frustrating and sad at the same time when they
Hmm.
lose their identity and so forth.
Hmm.
Mama Wu said my maternal grandfather, Papa Tim, had Alzheimer's. It was heartbreaking and devastating, really sad.
Yeah, that's what I was speaking about.
Kathy said dementia is an onset to Alzheimer's. I've been caring for my mom for the last 5 years. It's a constant struggle.
Hmm.
Misty said my grandmother and aunt both suffer from Alzheimer's. My aunt is battling it now and preparing to go on hospice. She lost the ability to eat, but I've watched my grandma die to this horrible disease. Watched her go through every stage, and I believe it was brought on by deep depression and loss.
Mm, that's deep.
Yeah, it is deep.
So let's jump into that. Then we'll go to the study part.
Okay.
Yeah, because I got a question with that as well. Is it correct with that as well? Like, kind of dealing with.
It's B949 WATV. You are listening to Vital. I am Lady Wu. Got my guys in the studio, and then we have special guests in the virtual studio. So one time for everybody watching all over our different social media streams. We see that people are everywhere. We are aware of that. So thanks for joining us wherever you are, be it YouTube, B949, any of my pages. Welcome to the show. So Eddie was just reading some comments, and we were talking about a few things, and then we're going to get into the study part of the research part. Research is so important. Like we're learning about research now
Hmm.
on another level with this COVID thing. Like research is what tells the story. But before we get to that, some of those comments, one that Eddie just read about the onset coming from depression. Any thoughts about that, Dr. Clay?
Yeah. I'm not. I'm not sure if I would say that the onset came from depression, or if it's something that kind of happened at the same time.
Mm,
Again, you need something to cause the actual physical changes and dying of the nerve cells to actually see Alzheimer's take place. And a lot of times, this actually happens years and years before we actually see the symptoms. So I think originally people thought that start seeing the nerves dying about 2 years before you start seeing some symptoms, but more recent studies have shown that these changes in your brain might actually happen up to 20 years before you see some symptoms. So I think with the depression, unless it was something that was like earlier on that the person had been dealing with for a while, I think it was something that probably happened at about the same time when you started seeing the symptoms of Alzheimer's disease.
okay, Jermaine.
So, being mental health professionals, like, what do y'all suggest the people, like the family members, do, like
Mm,
dealing with
Right,
situations as far as
right.
their parents or their loved ones forgetting who they are,
Yeah,
stuff like that?
yeah. One thing that I try to tell people that I kind of think about it when you get on the airplane, when they tell you the safety rules of being on an airplane, they tell you to secure your own mask before you try to help people around you, and it's kind of the same thing. We have followed caregivers and their family members with Alzheimer's disease in different studies throughout the countries for years, and something that's more common than you would think is that the actual caregiver passes away before the person with Alzheimer's disease.
Oh, well.
Because once you think about Alzheimer's disease, the physical declines are really in the late stages. So a lot of times through the progression of the disease, that person is physically healthy. So they might actually be in the early stages they might be in better physical shape than the caregiver. But they just have the memory loss and other things during the early stages. So it's very important for the caregiver to take some time for themselves, get other members of the social support network of the family involved to help out with the situation. There are services available that you can get. I know some people don't like people coming into their home and things like that, but you really have to realize what the disease is, what the progression is going to look like, and make sure that the family members and caregivers are taking care of themselves.
yeah.
There was so this goes back to like the decline of the nerves.
Hmm.
Um, I was wondering, is it as the nerves decline, is it like, so to speak, deleting memories, or is it just making it hard for them to access the memories that they have? Because you hear of
Right.
times where they'll say they remembered me today, or
Exactly.
you know, is how is that like? How is that progression?
Yeah, yeah, those are called. Sometimes they call those lucid moments, where you might talk to a person today, and that everything's fine. They seem like their normal self. Everything is good, but you talk to them tomorrow, and then they're kind of back along that progression. So
Mhm.
again, your brain not functioning properly, you will see moments where the memories are there, and then later you might go back and they're gone. So it just kind of fluctuates throughout the disease. So that person might be able to come up with those moments like so, for instance, when things like music therapy seems to work with people
Mhm.
with Alzheimer's disease. So, if there were certain songs that they liked, when they were growing up, religious songs that they enjoyed when they're in church, they might be able to sing that word for word. But and then that might bring back other moments that they remember. So things that they're familiar with can help bring back those lucid moments. So those memories are there. It's just again the brain is not functioning properly to allow them to access them.
Gotcha.
There are two questions that I want to get asked from our listening audience, and one of them is
Mhm.
on screen. And it reads, "Can people with Alzheimer's, um, I'm not sure what you meant right there, or does the learning capability stop when Alzheimer's sets?"
Oh no, no, they can definitely learn skills. Actually, we try to some of the studies that I'm involved with actually involve cognitive training and cognitive training, brain games, things like that. We see
Okay.
people who remain active playing those games, people who do complex things like learning a new language or learning new dances, things like that. That keeps the memory working, and in a lot of cases helps people, maybe delay the onset of any type of memory loss that they might have or maintain their functioning longer. So it's always important to try to remember, to try to gain new skills and keep your mind working.
Yeah, keep using it.
So,
Yeah, and to piggyback on that, I've had a few people, a few study partners or caregivers. They'll teach their loved ones a whole new routine.
Hmm.
Yeah.
That way it can help the caregiver when it comes to taking care of that person, and also still make the person with the disease still seem independent. So
Hmm.
they'll
Okay.
teach them a new routine about how to use stuff around the kitchen, or they teach them a new routine about how to wash their hair or brush their teeth. That way, it helps kind of alleviate some pressure off the caregiver, but also will give the person with the illness some type of independency.
Right.
Right.
Oh,
The
can I
question on
address that comment
screen.
about the loss of appetite? Can I address that one?
Yeah, let me ask it so everybody, because we got people everywhere. So,
Gotcha.
is loss of appetite a sign that we should start looking at, and at what causes you to lose the desire to eat with Alzheimer's?
Right. And again, it's all about your brain working properly. When your brain works properly, there's things going through those nerve cells that to tell your brain, hey, you're hungry. You need to eat something. You haven't eaten all day. If your brain's not functioning properly, you're not getting that signal that you're hungry. Even if you haven't eaten in days,
Wow.
even if there's food in your mouth, the signal that hey, there's food in my mouth, I need to chew. That
Hmm.
signal might not be coming through properly. So
Wow.
that's why,
So,
if you have people like in a nursing home, you
mhm.
can't just let them eat and lie down because, their brain they might not have chewed what's in their mouth. So they might, have trouble swallowing. And that's another reflex, just swallowing after chewing. So, all of these things in the late stages of Alzheimer's disease go away.
So with dementia,
Wow.
is it irreversible, or is there a chance that you might come out of it?
Mm.
The study showed that.
With now, if we're specifically talking about Alzheimer's disease, you're going to get progressively worse if it is
Progressively worse.
Alzheimer's disease.
Okay. Okay.
Yeah.
Wow. So progressively worse if it's Alzheimer's, but if it's dementia, what?
If it's dementia, and again, dementia is only the memory loss part.
Okay. Okay.
So yeah, so that's just the memory loss.
Wow.
That's not the physical.
So
So you have to have dementia to have Alzheimer's.
That's one of the symptoms, correct?
so dementia
And
is a
so
symptom
if the
of
memory,
Alzheimer's.
yeah. So you can think of dementia as just the memory loss. Think of Alzheimer's as the memory loss plus some additional things, and the nerves dying, and other aspects that'll make you have the physical problems later on.
And I think for a lot of people, we think those are two different things. So
Hmm.
this is good
Mhm.
to have a good idea of what it is.
Right.
Absolutely.
Right. And again,
So,
the cause of the dementia. will, make a person have different behaviors sometimes. So again, if it's Alzheimer's, if the dementia is caused by Alzheimer's, then we'll talk about the person getting progressively worse, that type of thing. If the dementia is caused by some type of frontal temporal problem in the brain,
Mhm.
then those are the people that might act out more often, or you see changes in the behavior, or them become aggressive with you, or walk around and curse a lot, those types of things. So the
Wow.
cause the cause of the dementia, sometimes you can look at the symptoms that the person is having and how their behavior is changing, and it'll give you a clue on what the cause of the dementia is.
The comment on the screen says that's scary. Makes me
Yeah,
want to take better care of myself.
me too.
So yeah,
Me too.
me three. So
Yeah.
just think, and I guess it started for me when you said late 30s, 40s. I'm like, well, I ain't but like
Now that's
20.
that's not as common though. You don't see that
Okay.
a lot. Yeah, you definitely
Okay.
don't see that a lot.
Cool. Well, let's get into the research part. So you all are
Yeah.
actually putting this work in currently. This is not, we're not just talking about it just to be talking about it. You all are actually making discoveries as we speak
Right.
and wanting people to jump in. So Jasmine, speak to the research. What's happening?
So we are now a federally funded center. We received a grant this year, and so with our research, we're actually looking for participants because what we're doing is we're doing memory testing. We're also doing blood samples because we're trying to see like what is causing this? Is it a biomarker within your DNA? Is it our social environment? Is it stress? What is really causing this? What is one of the key factors that's causing this disease, especially within the African
Yeah.
American community? Because we are 2 times more likely to get it, but we're also not in that much research. So
Mm,
a majority of the time when people do research, we're mainly studying from the white person counterpart. We're not getting from our actual side. So a lot of things like whenever you see something on TV, oh well, research has shown most of the time that's
ain't
not
got nothing to
from
do with
us.
us, right?
Mhm.
And so we're trying to get more of us involved in research. Always people always ask me questions. I try to be as transparent as I possibly can. Because as we
Okay.
all know, when it comes to research in our community, it doesn't have a great history,
Mhm.
Yeah, right.
especially
So
here in Alabama.
right. That's a big part of what, I
Mhm.
spoke about COVID because that's all we've been hearing about.
Right.
And that's the only research we've been hearing about. And that's what we've been hearing everybody say, no, I'm not doing it.
Mhm.
But I encourage us to be a part of, like nobody wants to be, I don't want to be tested. I don't need them trying to figure it
Right.
out on me.
Right.
But let's speak to the stigma part of it. Like
Yeah.
if I'm a part of something, like Jermaine
Right.
said, his grandfather just passed with this as an issue. My great grandfather, Eddie is speaking about. Well, do you have anybody in your family that you can think of?
No, my family debated whether my granddaddy had dementia or not until he died, and they
Oh,
never really did anything about it. But it just seemed to be a constant. I imagine it's a constant dialogue in a lot of black families that don't even have dementia because, like my early question, is hard to discern between
personality.
Right.
yeah, well,
Mhm.
when what changes are based on ages versus which
Right.
changes are based on something that is declining gradually.
So in
Right.
my mind, it sounds like three people who would be interested in this. Not saying, this is just saying if we can share these personal stories and like go back to
Mhm.
people that we know personally to say that hey, they were affected by it. So you
Mhm.
know what, I want to be a part of the research so that I can know what I'm up against or help somebody else from my perspective.
Mhm.
So what are some of the qualifying factors, Jasmine?
So to be part of our center, you have to be over the age of 55. You can be healthy. You can be a healthy participant, or you can have a diagnosis of type of memory disorder.
Okay.
And that is really the three main things that we're looking for you to be a participant. Because I've gotten people to say, "Well, I've had cancer in the past." That's fine. Are you currently doing chemotherapy? If you are not currently in chemotherapy, we can take you. I have metal. I have metal in my body. That's fine. You don't have to get a PET scan. We can always do a biomarker test by getting your blood work. Oh well,
Okay.
I live in a different state. That's fine. When you come to Birmingham, we can go ahead and make arrangements to have you be tested.
Mhm.
Cool.
Yeah,
What does the test
very
consist
important
of?
too.
Okay.
With COVID, what we've done, we've moved as much of the stuff as we can to be remote. So things that we were doing in person, we're doing remote. But Alzheimer's is a medical condition, so there are some medical tests that we ask people to do that they
Mhm.
would still need to come in to do. But
Mhm.
we are trying to limit as much contact as we can.
So blood work, skills tests, assessments, and things like that. Is that really it?
And so basically with the study, it's about 3 visits to UAB. Let me rephrase that. It's about 2 to 3 visits. And I
Mhm.
say that because your first visit will be us gathering information like your health history and all your demographics. And we do memory testing. That is about the visit lasts is about 2 hours. Really on average it's been an hour and a half, but I always have to give people more time. So 2 hours at the most. And then your next visit will be you meeting with the neurologist and our nurse, and we'll be doing blood work. The reason why we have it split up is because you have to come in fasting, and nobody wants to do memory testing for 2 hours hungry,
Mhm.
and
Right.
then talk to a physician and then give your blood. That's just too much in one visit. And
Uh-huh.
then your visit could possibly be if you do qualify based off our pet department for PET scans. As some of you might know, PET scans are very, very expensive. Insurance might not even cover them. They can be like costing thousands of dollars. With our study, you get 2 PET scans included. So, and you don't have to pay for anything. It's free. It is free to the participant. And by participating in our study, you get paid too.
Mhm.
Bing. Let me hit that bell. Because that's the
Yep.
part. So, like, is you're doing a good deed. You're finding out information
Mhm.
about yourself. Like, this is something that you can
Right.
take with you and like pass on to your family, but you're also being compensated. So that's awesome.
Yes.
Anybody ready? If they're ready, how can they reach you all?
So if you want to reach us, you can email us at alz@uabmc.edu. Again, that is alz@uabmc.edu. Or you can call us at 205-934-6307. And again, that's 205-934-6307. And you can reach out to our Facebook page. It is a UAB Alzheimer's Disease Center.
Awesome. Anything else? Anything else? And for those of you who are watching, you can see the information on the screen, ALZ at uabmc.edu, 205-934-6307. And it's posted on our social media as well.
Also
Yeah.
want to mention lastly with the research, it is a 3 year long study. So when you come back for your second year visit, that is when
Mhm.
the physician will go over all of the information with you. That's how we get you to come back. So right before your second year visit, the neurologist will either sit down with you or call you to go over to go over your testing with you, to go over what the neurologist found during their exam, and if you did a PET scan, then they'll go over the imaging as well too.
Wow. So I gotta wait a year. Okay. I'll come back.
I guess a couple of more things. So
Uh-huh.
also on our Facebook page, we have a link where you can join our mailing list, so you can
Mhm.
kind of stay up to date on the activities of the UAB Alzheimer's Disease Research Center. So click on that link and put your information in to join our mailing list. And also, again, kind of like Jasmine was saying, so we have these Alzheimer's centers throughout the country. There really aren't enough Blacks in these studies. So it's important for us to participate. So the findings that we're getting from these studies, we know that they can be generalized to Blacks as well. Again, we don't want all of the research to be based on, studies that have been done that are predominantly, I mean, almost all white. We want that. We want that inclusion. So, any drugs that are developed over time, we want to make sure that information can be generalized to us. And if you have any questions about research, call us. We can give you more information about the study. You will receive total informed consent. If you have any questions, before you sign the consent form, feel free to ask. Jasmine and the other staff members are, you're not under any type of pressure to participate. So if you call and you feel like you have to participate just because you're getting information, then that's not the case. You can just call and get more information and make your decision at a later date.
Okay.
So again, I ask. I
Mhm.
think we touched this earlier, but if we lack in people that are getting tested or getting I guess screened,
Hmm.
how do we know that we're so flawed in this particular disease?
Yeah, yeah. What really? So you can really think about the death rates. If you want to really look at it, I guess when you look at all causes of death in the United States, Alzheimer's is like number six. So when you compare those causes of death between blacks and whites, then that's one glaring way that we can see that we're at more risk because of the cause of death in a lot of people.
Wow.
Gotcha.
All right. So are we the information has been posted. I want to make sure that everybody has asked their questions and that we've answered everything from our viewing and listening audience. Do you all see any other comments or questions that we need to ask from your sides from the streams that you're watching?
Um,
Anything that you want to address?
And again, if we did not get at your question, if you are on Facebook, shoot us a message with your question to the Facebook page, and someone will contact you to address that question. If it's something that you remember later that you didn't get the opportunity to get addressed in the comments.
Awesome. And the number is 205-934-6307. 205-934-6307. Dr. Olivia Clay and Miss Jasmine, who will get you signed in and ready to roll. So I do see a question that just came in. Is there a life expectancy after you have been diagnosed?
Yeah, that's a tricky question because
Yeah.
when your diagnosis happens, is it kind of differs. So on average, you know, blacks are diagnosed later within the progression than whites. So, when does the diagnosis take place? That really kind of, affects what the life expectancy is. And I mean, people can easily live, 20 years with Alzheimer's disease because, if that person is taking care of themselves, the progression can be really slow. So again, don't think about it as, oh, this person has Alzheimer's disease, they're going to die tomorrow. That's not the case. You really want to keep them physically active as you can. You want to keep them engaged as often as you can. Keep yourself as the caregiver engaged and as healthy as you can, because of course, the better the caregiver deals with the caregiving role, the better outcome the person with Alzheimer's is going to be. So it can be an extremely long life expectancy after diagnosis. So it's not like okay, this person has Alzheimer's, it's going to be a wrap tomorrow. It's
Yeah.
really can be a long life expectancy.
I have a caller on the phone lines. Want to get them in. Caller, you're in with Vital V949. What's your question or comment?
Hey, look, lady, woo woo.
Hey, you got a question or comment about Alzheimer's?
Yes, ma'am.
Go ahead.
We need to go get tested,
Mm-hmm.
and we need to stay our social district, wash
Yes.
our hands,
All right, Mr. Madison.
and roll tide.
Okay. Thank you, sweetheart. It's been a minute since we caught him. I almost knew that was Mr. Madison. That's one of our favorite friends here. So yeah, he was absolutely right. Sign up for the study if you have, concerns, or just if you want to just be a part of the solution and want to know what's up. Like if you've had a relative or somebody that you knew or somebody that you know that's currently going through and you want to be a part of the research to help figure out what is this thing? Like how can we slow it? How can we stop it? How can we cure it? This will be the opportunity for you to do so.
Yeah.
One more question.
Can I
What
say
you got?
one thing before we get to that question?
Sure.
So also, UAB has a memory disorders clinic. So
Mhm.
if if your family member needs to try to see a physician right away, they should contact the UAB memory disorders clinic.
Okay.
Now I'm
So
not saying they can get in right away, but so if they actually need to see someone right away, being in the study is not the way to do that. It would actually be to call the UAB memory disorders clinic.
gotcha. So the UAB memory orders clinic
Disorders, memory disorders.
disorders clinic would be where you call for that, people. So the final question that we're going to ask tonight: what about an immediate family member of people who get Alzheimer's or dementia, and the patient themselves blood being tested versus the family of the same age range who didn't have any disease? So I guess like if same bloodline. This
Hmm.
is my grandma, this is my sister, whatever, and then I come and I do the test
Right.
because I know that my relative had it.
Right.
And
Um.
that's a
So
tricky
go ahead.
that's a very tricky question because just because your mother might have had it, you might not get it.
Hmm.
But you won't know that until you come and you test it. I have like one of my closest friends, her mother has early onset, and either her or her brother have the gene. One of them has the gene, but they don't want to get tested for it. So they just want to live their lives out and not know. Me personally, I would want to know so I can go ahead and prep my family for it. But
Yeah.
that's a tricky question because it really depends. Because genetics is very, very like it's different.
Right.
Well,
Right.
the
And
gene,
again, with it being a
you
medical
get
condition,
genes.
there are some genes that can be tested for that'll give you a better idea as far as your probability of having it.
Oh, now you tell us now we use genes. Okay.
It could be in your gene. I mean, but absolutely. So what we'll do, we'll check back in with you guys very soon, just to kind of
Okay.
hear what has happened. If more people have come in, and I see that we have a lot of interest in Alzheimer's and disorders and things like that. So everybody wants to know, and for those of you who want to know, if you're 55 and older, you can be a part of the study. One more time, what's the contact information?
It is alz@uabmc.edu, and you can reach us at 205-930-6307. And again, if y'all leave us a voicemail, one of us will get back to you. UAB has us working at home and then in the office. So
Good.
one of us will get back to you within 24 to 48 hours.
All right. Thank you all so much for sharing with us tonight and teaching this lesson on Alzheimer's. And we appreciate your time and the information that you brought. And hopefully, our vital audience will be some responders to what they've heard tonight.
Thank
Thank,
you.
thank you for the time. We appreciate it.
Thank y'all.
Absolutely.